Nearly 250,000 men will be diagnosed with prostate cancer this year.
It's the second leading cause of cancer deaths among American men. In 9 out of 10 cases, there are no warning symptoms. KXAN's David Scott brings us the story of one man battling a recurrence of this disease and the doctor using the latest robotic surgery to save his patients.
David Bryce was 52 when he first came in and got diagnosed. That may seem young, but it's not that rare. Further evidence you shouldn't wait to your golden years to get a checkup. 2/3 of prostate cancers turn up in men 65 and older. Fellows like David Bryce can be all too casual about getting a checkup. When he got the news, he told a friend.
He said instantly, "That's too young." That was my reaction too. 52 is, you don't think about that.
Dr. David Cuellar used the latest robotic surgery on David.
And had he come a little bit sooner, perhaps the surgery may have been the only treatment he needed. But sometimes these things in a matter of 1 year can progress from early to late. I've seen people's PSAs go from normal to triple normal in a year.
But a tiny bit could not be reached, a recurrence. Now, David has just wrapped up the last of 39 radiation treatments.
If there's 2 cells left that can reproduce, it'll be years, but they'll come back. So we'll see.
Doctors say you'll never know for sure. David's prognosis?
Worst case scenario is 5 to 15. Best case scenario is that the radiation that I just finished is going to knock it out. So we'll see.
African Americans, especially with a family history of prostate cancer, should start annual checkups at age 40. Hispanics and whites, age 50, earlier if they have a family history. And you should get both the PSA blood test and a rectal exam.
And together they pick up probably 2/3 of the cases. But one by itself is not good. You need both.
David Scott, KXAN News.
Well, you may have noticed the mustaches there. Both Dr. Cuellar and David Bryce are participating in Movember. That's a movement to raise money for medical research, including for prostate cancer. Taking a closer look, 1 in 7 men will be diagnosed with prostate cancer during their lifetime. 1 in 36 will die from it. New surgeries have reduced the side effects men worry about, such as incontinence or male performance. Doctors emphasize getting your annual exam and consulting them about any questions you may have.